Does the Affordable Care Act reduce healthcare inequality? Have you ever wondered how a law can change the way people access healthcare? The Affordable Care Act, enacted in 2010, aimed to tackle the issue of healthcare inequality. This law was designed to increase health insurance coverage for millions of Americans, especially those who were previously uninsured. One major way the Affordable Care Act made a difference was by expanding health insurance coverage. This expansion was particularly beneficial for racial and ethnic minority groups. Historically, these groups faced higher rates of being uninsured compared to non-Hispanic whites. The Affordable Care Act included provisions like Medicaid expansion, which helped narrow the gap in insurance coverage among these populations. Another important aspect of the Affordable Care Act was its focus on reducing socioeconomic disparities in healthcare access. The law provided subsidies for low-income individuals and expanded Medicaid eligibility. This meant that more people from lower socioeconomic backgrounds could afford health insurance. Financial barriers often prevent marginalized communities from accessing necessary healthcare services, so this change was significant. The impact of the Affordable Care Act on reducing healthcare inequality is also evident in its efforts to address racial and ethnic disparities. The law led to substantial gains in health coverage for minority groups, especially in states that chose to expand Medicaid. This expansion not only increased access to healthcare but also helped reduce the disparities in health outcomes linked to lack of insurance. However, challenges still exist. Some states have not expanded Medicaid, which limits the full potential of the Affordable Care Act to reduce disparities. Additionally, issues like underinsurance and access to quality care remain concerns for many communities. In the context of social stratification and inequality, the Affordable Care Act represents a step toward addressing broader societal factors that contribute to healthcare disparities. By expanding access to health insurance and reducing financial barriers, the law has helped mitigate some effects of social inequality on healthcare outcomes. Yet, ongoing efforts are necessary to fully tackle the persistent disparities in healthcare access and quality. So, does the Affordable Care Act reduce healthcare inequality? While it has made significant strides, there is still work to be done to ensure that everyone has equal access to quality health care.